Over the last 60, 70 years, U.S. support of medical research through the National Institutes of Health, which is the main way in which the U.S. government supports research, has been a critical part of how we have seen many advances happen in health. Heart attack deaths down by 60%, stroke by 70%, advances in neonatal mortality, all kinds of things that we take for granted. Why did they happen? Well, it's because our nation's universities all over the nation, including right here in Mississippi, supported by grants funded by the NIH, came up with amazing insights and working with the private sector, brought those forward to clinical benefit. It is a success story of the finest sort, and we have been the envy of the world for our ability to do that. We are being challenged now by other countries who are trying to take our model and build on it, and maybe even build it on it faster than we are. But there's no question that of the things that the government has done that have benefited all of us, medical research ranks very highly on that list.
You mentioned China. Are there other emerging countries, areas of the world that are kind of catching up to the U.S. as far as medical research?
If you look at countries that are investing a larger proportion of their GDP in research than we are, actually the list is getting fairly long, but China, India, Brazil, South Korea, Europe, England, all of those, despite what is in many instances difficult economic circumstances for them as well, see investment in medical research as an opportunity both to advance health and to grow the economy, because this is the kind of investment that has lots of spin-offs. Here in the U.S., you can see that the dollars that NIH supports in terms of grants to universities all over the country directly support about 480,000 jobs. But if you count all the spin-offs, it's more like 7 million jobs, high-quality jobs, jobs that the rest of the world would love to take away from us. So it is a very strong economic argument as well as a health argument.
Senator?
Well, it's interesting. It's competition being used as a way to expand the reach of not only private companies but governments as well. And that's a big challenge for us to overcome. And so we need to get used to the fact that we're going to have to invest public dollars along with encouraging through the tax code or otherwise investments by the private sector to the fullest extent of our capability.
What about, you mentioned that kind of towards the end of your presentation, the NIH and the grants, I think there was like 1 out of 5.
1 out of 6.
1 out of 6. Can you talk some about that, kind of flesh that out for us, the difficulties that you have?
So the way NIH spends the taxpayers' dollars that are given to us each year is to solicit the best and brightest ideas from scientists all over the country, including quite a few of them here in Mississippi. They send their ideas to us in the form of a grant proposal. Those are reviewed in the most rigorous system in the world, a peer review process, where other people who are experts in that field look at the proposal, decide what its merit would be, assign it a score. And then we look to see how many of these grants can we actually fund. Ultimately, over the course of the last 50 years, the answer has been about a third have been fundable with the dollars that we had available. But over the last few years, that has gotten much tighter, and we're down now to about 1 out of 6, which makes it very stressful, as you can imagine. If you're the investigator who's written a very innovative grant and sent it off to NIH, and you get back the note saying, sorry, you didn't quite make it. We kind of liked this part, but it wasn't quite to the point where we could fund it. And then you have to try to rewrite it and resubmit it. And after a while, after too many rejections, people really begin to get discouraged. We are at a difficult point right now because of all the economic struggles of our nation. But I do worry that our biomedical research workforce, the scientists working here in Jackson and lots of other places around the country, are our most important resource. They're the people we're counting on. That's our future. We have to be sure that we don't let them down.
And on that, Senator, UMC is a research hospital, so how important is what he was just saying? How does that apply to Mississippi research?
Well, I think the likelihood is that we're going to see heightened competition for available federal dollars that are getting scarcer as we go along. It's a big challenge. A lot of military challenges, things that threaten our national security, we have to be prepared to defend against. Keeping our economic opportunities alive and well for investment by private sector people and corporations who want to broaden their base of customers and do the things that they are organized to do for the benefit of the whole country. So there's a lot of competition out there. But we are the strongest nation economically in the world, and if we don't do it, who will do it? So we have to recognize that too as a humanity demand on our time and energies and our wealth as well.
Let me say we're lucky to have Senator Cochran in the Senate at a difficult time like this where hard decisions have to be made. He's been a wonderful leader for Mississippi, for medical research, for trying to make the right decisions even when there aren't any easy decisions to face you most of the time. I'm sure you would agree with that.
That's right.